Thank you, and thank you for your powerful message, Judge Broderick. So we do have one question that I've seen so far, and if anyone has any further questions, they can put them in the chat box so that we can get to them. And see, as a school nurse, this comes from Paula. I can say that we see and hear the hurt that you described in the students. There's a lack of enough mental health counselors to meet the need. And would more funding be the key?
Well, first of all, thank you for showing the video, and thanks all of you for watching it today. Because as I said in the video, I need your help. And you are a unique group of people who touch healthcare. Funding would help a lot. It's not the only answer, however. I've been to so many schools now, middle schools and high schools, and I will say that the folks in those schools, in the public schools, are doing a very good job with the resources they have. I'm very impressed by them. On the other hand, I think the solution to the problem is to develop a mental health system in the United States, which we do not have and have never had. And so the problems that can be dealt with in school, it's important you have good people there. I know you need reinforcements. But once you leave the school building, referrals are hard. And we also need to ask parents to engage in this topic. And I don't want to sound righteous about it because I was probably like a lot of parents and didn't want to go near the topic, but I see it now. I see it now. And parents need to engage. They need to be willing to talk about it. They need to understand that their child doesn't have a character flaw or a defect or some imprecision. It means their child is like 1 in 5 other kids that's having a mental health issue, much of which is treatable. When Hillary Clinton ran for president, she said it takes a village, and she was roundly criticized for that. When it comes to mental health, my experience has taught me it takes a village, and not just healthcare people, but everyone. So yes, we need more resources, but we need a different conversation outside of the school building as well.
So thank you. One other, I wonder if you could share something with us about the impact that COVID has had on persons seeking mental health or providing that care to them.
It's had a significant impact. All of my work for the last 4+ years was all pre-COVID. So all the kids I hugged and talked to, all the kids with the wet eyes, all of that was pre-COVID. Pre-COVID, 1 in 5 adults, 1 in 5 adolescents had a mental health problem. And then if you total up all the people who love those people, it's a much bigger circle. But the level of anxiety and depression, the level of suicide ideation has gone up dramatically during COVID. And to some extent, it's understandable. It's been stressful for all of us, but especially on young people. The loneliness, the isolation, the worries are very real to them. And they don't have the gift of age, so they don't have much perspective about this time, which a lot of adults do. But a lot of folks are thinking, boy, it'll be great to get back to normal because there were no problems in normal. Let me just say, when it comes to mental health, the baseline was disturbing. And I don't know if the students who are listening know what the youth risk behavioral surveys are. But if you don't, I would encourage you to look them up. The Center for Disease Control issues these questionnaires every 2 years to public high schools. There are about 80 questions, and they're answered anonymously by students. All they ask for is your year in school and your age and your sex or sexual preference. That's it. And a lot of kids answer these. They do that in New Hampshire. And let me just give you some touch points, which should shock everyone, I hope, and maybe shock us to do something. The national survey is taken in 2019, all pre-COVID. Over 45% of high school girls are depressed. And the question doesn't say, are you depressed? It says, have you been sad or hopeless for 2 consecutive weeks or longer in the last 12 months? So you found it difficult to engage in normal everyday activity, 45%. About 25% of those girls all across America said they seriously considered, that's the question, seriously considered killing themselves in the last 12 months. Think about that. And about 15% of those girls said they had made plans in the last 12 months to kill themselves. It's stunning to me. In the state of Maine in 2019, every state gets its own data. They don't share it widely, by the way, with parents, which should concern all of us. In the state of Maine in 2019, 8.9% of high school girls in Maine attempted suicide, not thought about it, attempted suicide. From 2007 to 2017, according to the CDC, the rate of suicide for people ages 10 to 24 went up a little over 56%. How is it that we have those data and we're not acting? You know, and I know, if it were reported today that 45% of all high school girls had diabetes or breast cancer or COVID for that matter, it would be stop the presses, above the fold, public health emergency. Somehow with mental illness, it's just not talked about. And so the medical health community, school nurses and counselors, they know what I'm talking about, but they by themselves can't fix it. We can, if we want to do that. And I was part of the problem for decades. Trust me, I know that. I'm not part of the problem now. I see the problem clearly, and I know we're not doing nearly enough.
Those are outstanding statistics. Do you know when the 2020 results come out, or
They give them every 2 years in the odd numbered years. So they will give 2021 probably this fall, and they'll release the results probably next spring. But what's really disturbing me, and it's not because there are bad people, please don't misunderstand. I'm not blaming anyone. It's just the society we're living in. So in the state of New Hampshire, if you want to find out the results of the youth risk behavioral surveys, you can go to the New Hampshire Department of Education website, and they will tell you the results, not by school, but by geography. Then you talk to the educators and you say, do you send the results home to the parents of the students at your high school? And almost all of them will say, we don't do that. They will send them to the school board. They'll send them to the home office, the district office. And finally, I've asked enough times, finally, a senior administration person in education, I said, why don't you send them to the parents? And she said, because if we do that, the parents will blame the schools. So we don't share them. And that's probably true. And I don't know why schools are feeling that way, because they're doing more than anyone to help these kids. But if we don't talk about it and normalize it and put some sunlight on it, why would it suddenly get better? Over 50 million Americans, as we speak this morning, have a mental health problem. Over half of them are getting help nowhere, and a lot of them are waiting long, long times. Last, I want to give you one more data point, which is so disturbing. On Valentine's Day this year, 51 adolescents were in community hospital emergency rooms experiencing acute mental health episodes, 51 adolescents. And many of them waited their hours, some of them waited their days. Some of them may have waited there for a couple of weeks before appropriate treatment was available to them. Every night in New Hampshire and around the country, there are dozens of people, adults and adolescents, in community hospital emergency rooms, and they're not equipped to deal with acute mental illness. It's not their fault. That's just not how they're based. If we had any other illness in the United States where people were at risk, we would not tolerate that. You know it, and I know it. If there were 51 adults in ERs at risk of a massive heart attack, but the ERs couldn't help them, how long would we tolerate that? We wouldn't tolerate it 24 hours. But when it's mental health or mental health in kids, we somehow think it's okay. It's not okay. So one thing my last 4 years has done, which I think you can tell, it's made me very impatient for change. And we need voices. We need healthcare people to speak out. We need community members. We need businesses. I've just talked too many kids to pretend it's okay. It's not okay.
Yeah, thank you for that. We do have a question in a looking from a different lens here. While you were in your hospital stay, did you notice, were there any special characteristics about the nursing staff that you could hope that we would all, because the audience here is mostly graduating nurses, that they could take to heart as they enter the profession?
Let me say this. I know the President of the United States always says nurses are from heaven. I agree with him, by the way. I love nurses. You are the care in healthcare. I mean that. My time at the hospital was painful to recall. The only part of it that I took away where I felt really safe was my time with the nurses. I'll give you an example. For the first week or 10 days I was there, I wasn't sleeping a whole lot. And the nights were endless. And my wife would come every night, but she had to leave at 10 o'clock whenever she had to leave. And so some mornings at 1 a.m., 2 a.m., I'd be lying there in a dark room and a nurse would show up. And there was one nurse who came almost every night. She must have had the 11 to 7 shift. She was like an angel to me. And one night she was sitting on the side of my bed and she was holding my right hand in hers. And I loved talking to her. And finally I said to her, you probably have a lot more important things to do. I don't want to hold you up. And she said, I think what I'm doing is very important. Oh my God, I can't tell you what that meant to me. I think as it relates to mental health, nurses, I think, need to be sensitive to that and to patients. And I know the nursing profession comes with its own set of pressures. Believe me, I get that. But to the extent you can stop and spend that extra minute with someone and kind of talk to where they are and find out where they really are, you can make a difference. That nurse that night who was holding my hand, and when I said you should be doing something more important, she said, I think I am doing something important. And she was right, by the way. So I think just sensitivity to people who find themselves in a very strange place, namely a hospital. And doctors are great, and some of them have great bedside manners, but some of them don't, and some of them are under enormous pressure too. So they're there to tell you what you need to know, but not necessarily find out who you are. Finding out who your patient is, I think, matters a lot. That would be my recommendation.
Thank you very much for that. Remember, if you have a question, enter it into the chat box so that we can get your questions answered. There is another question, a couple of questions. One that says, can you talk about how we can be advocates for change on mental health? And what should we do? Should we be calling our state reps?
My answer is simple. Don't try to do world peace. It starts locally, very locally. It's a conversation. These little cards, I don't know if you can see that. These are the 5 signs cards. These, if you can read at a 3rd grade level with these little emoticon faces, these are the 5 most common signs of mental illness. They're not diagnostic, but it's hard to have a mental health problem and not show one or more of these signs. With the help of Dartmouth Hitchcock, who's been underwriting all of this, I've given out about 450,000 of these cards. I don't mean drop them from a helicopter, I mean giving them out. And my request has been and remains, I would like everyone to get one of these cards. I'd like you to put it on your refrigerator at home and learn the 5 signs. If you have children, I'd like you to have them learn the 5 signs, or a spouse or a partner, learn the signs. If you have one of these that you can take to your workplace, do that. And people will start talking about it. Trust me on that. I'll tell you a very funny story. I went one day to Elliott Hospital. Elliott Hospital. And I spoke at a grand rounds, mostly to doctors and nurses. And I thought it was very strange that I was speaking to doctors and nurses, but they were interested. And I didn't bring the cards with me. And so the next day, the doctor, who was in his early 40s and had invited me, sent me an email, said, "John, could you drop by some of those cards because I want to give them out?" So I did the next day. I dropped 100 of them at the desk. He wrote me that night and he said, "John, the cards went in a heartbeat. But I want to tell you something else." He said, "I got home tonight, I had the card, and after dinner, I decided to talk to my own children about it." I had 2 girls, I think 8th grade and 7th grade. He said, "I realized I'm a physician. I'd never mentioned mental health to my children. So after dinner," he said, "I took out the card and I held it up. And I said, 'Girls, I want to talk to you about this card.'" And he said, my 8th grade girl gave me a big smile. And she said, "Dad, has Judge Broderick been to the hospital now? He came to my school too." And he said, "We laughed about it, but we talked about it. And we put it on a refrigerator like you asked." And I said to my daughters, "If you ever feel like this, you should tell Mom and Dad. Or if you have a friend at school that you're worried about who seems to be showing those signs, you should tell Mom and Dad. No one's going to get in trouble. No one did anything wrong. It's just a health issue, and most of it's very treatable." That's how change happens. And eventually, change will come about because enough of us are willing to say publicly, my mother, my father, my cousin, my sister, my friend, myself have a mental health issue, and I'm finding it difficult to find help because we don't have a system. The reason we don't have a mental health system in the United States is because we allow there not to be a system. No one's going to fix it for us. I know that much. If they were, they would have done it by now, for heaven's sakes. So we have to take responsibility, start small and build out. That's my advice. That's my request.
So I don't see any new questions. Let's see. One of my own questions is on those cards. Are they easily accessible? Like we could look at them online, or
You can go online, or if you wanted me to send you some, I can do that. There's no charge for that. But you can go to the Dartmouth-Hitchcock React website. On the back of this card, something says react. How do you react if you find the signs? Well, you can go to changedirection.org, the national campaign, and you'll find the 5 signs. But I really encourage people, especially nurses. You're so vitally important in the healthcare system in this country. If you make it a priority at your work site, in your hospital, in your community, in your family, it suddenly will start to gain traction. We have ignored it forever. And you all know that. I mean, we all know that. We don't deal with it. And there are millions of people, many of them kids, many of them I've hugged, for heaven's sakes, and half of them aren't getting help. Let me leave you with this if I can, because this has happened to me many times. Parents will seek me out. I wish I had your skills, by the way. I don't, but I have to stop myself. But they seek me out because they think I can help them, and I try wherever I can, getting them to the right people. But they'll share with me that they can't get help for their child. And I've had parents say, it's going to be 3 or 4 or 5 months before I get help for my child. And I say to them, you know something, if your child today fell in your driveway and broke his or her leg, you'd call 911. And an ambulance would come in short order to your driveway. If you have a 15-year-old son or daughter with chronic mental illness, who do you call? When are you seen? Who pays for that? And for how long? That's the immorality of how we deal with mental illness in America. It's just not right at so many different levels. And while I shouldn't feel a fiduciary duty to the kids I've hugged, I do. And I have a voice they don't. And I'm asking people everywhere I speak to pay attention to this issue and help change it and build a system that we so desperately need. And that's my plea to all of you today. But I appreciate you listening. I really do.
Great. So if you need to go, we can give some time back to the students. Or do you have time for one more question? On that React, do you know if it's being used as a screening tool, like within Dartmouth Hitchcock?
They are starting to do work at Dartmouth Hitchcock on mental health screening. They are. Are they as advanced as I would like them to be? No, nobody is actually. What we need to do, to be honest about it, we need to integrate public health, mental health, and physical health in the United States. We need to have integrated delivery networks. We need to have screening in pediatricians' offices. Mental illness is the only illness I know that we usually don't treat until it gets to stage 4. I mean, every other physical illness, oh, don't let it get to stage 4. That's when we start to pay attention to mental illness. So screening is fundamentally important. It should be in every work site, not so that you'll be penalized, but so that you might get help. But we all need to do a better job.
Wonderful. Thank you so much. And thank you for sharing your story and the work that's being done. And I'm sure the nurses have something to surely think about and how to incorporate it into their practice.
Thank you very much. And thanks to all of you for listening. I appreciate it. Thank you.